My name is Dr. Trevor Dixen. I'm the founder of the Jaja Foundation, and I've been having this foundation for the past 3 years. Well, tonight we had a fundraiser, the Jaja Foundation, which is Jamaicans Abroad Helping Jamaicans at Home. We had a fundraiser to raise money for the public hospitals in Jamaica. We specifically deal with hospitals in the public sector, whether it's in Mandeville or Christiana Spalding's or Kingston Public Hospital or Spanish Town Hospital. We support hospitals, so we do collaborative efforts with the hospitals down there. I have found that this has been successful because we collaborate with, when I say we collaborate with the hospitals down there, we don't just decide what we're going to do and just go down there and do a project. We speak to the team in Jamaica, we deal with the leadership in the hospitals, and we find out what their needs are. And once they have identified what their needs are, we decide if it's a project that, number one, we have the funding to follow through and finish, and number two, we decide if the integrity of that particular project. If somebody came to me and said, "Can you teach me ultrasound?" The first question that I would say to myself is, why should I teach you ultrasound? And if the answer is because I want to learn the trade so I can bring patients in my office and bill them for doing ultrasound, I'd be a little bit skeptical, okay? But if you tell me that you want to learn how to use the ultrasound because you want to benefit people who can't afford to pay for an ultrasound, or because patients who can't afford the higher level of care of other institutions, then I become more interested because I can see how the poor, disenfranchised people of Jamaica can benefit from it. I think the state of healthcare in Jamaica is no different than the state of healthcare anywhere else. Only thing, it's on a worse level because from the beginning the healthcare system was very strained in the sense that a large majority of the patients in Jamaica can't afford the level of care that they probably deserve. So the state is pretty bad. The government is overwhelmed because when the budgets are being divvied out, the healthcare budget becomes smaller and smaller each year because of the national debt of the country and other factors, borrowing from the IMF. So the governments are forced to make decisions that's not always popular. So therefore, the healthcare system in Jamaica is overutilized. It's a very big strain on the system, and therefore, as a result, you go to the hospital, you see long lines, you see patients who can't afford to get tests done, and it becomes a domino effect where overall the people are dying, literally. Medical tourism is a very interesting concept. Medical tourism in its true sense is that having foreigners come to Jamaica and getting their health care, whether it's plastic surgery or some other surgeries that they might not be able to afford here in the States, they can go to Jamaica and get these surgeries. And that's a very interesting concept, and I think it's something that's probably there's a market for. But the Jaja Foundation, we don't really concentrate on those medical tourism because I don't see how that really benefits the poor and disenfranchised people of Jamaica. It's something that's a market for, definitely, and I think it's a market that Jamaicans can probably make some money out of it. But as far as the disenfranchised people, I don't see medical tourism benefiting the poor man on the street who can't afford to buy his blood pressure medicine. I set out to renovate 4 rooms at the Kingston Public Hospital, and that project started last year, this time after I raised the funds from this function I kept last year. The funds from that, we used it, and we kind of got some funds from myself, and we kind of went down there and we looked at 4 of the most dilapidated rooms that we thought in the emergency room at Kingston Public Hospital, and we decided we were going to renovate the 4 worst looking rooms. The Jamaica government, the Minister of Health, through the efforts of Dr. Ferguson and the administrator at KPH, Mr. Littleton Shirley, he matched us and we renovated a total of 8 rooms. So I did 4 and they did 4. Whitty, I know Whitty from Utica Avenue in Brooklyn. Grown up in Brooklyn, from East Flatbush, and music is something that I was very passionate about. So I'm very much in the dancehall business. I was in the dancehall business as far as loving the music. I used to work at Music Master selling records, and then I used to follow the sound system, Sir Tommy's back in the days, Sons Jr. and Prince Lloyd from out of East Flatbush. So I'm from the dancehall era, and Whitty kind of taught me the music. I used to sell records. I went to Jamaica, visited Whitty, And Whitty had a thing called Uptown Mondays, and he said, would you like to be a part of, would you like to come into the dance hall and do HIV testing and diabetes and hypertension in the dance hall? And I said, sure. And that's how that effort came about. It was a collaborative effort between the Uptown Mondays, Father Whitty, and Jaja Foundation. January, we plan to partner with Bustamante, and basically the Jaja Foundation, once again, a collaborative effort where Columbia Hospital was having a very hard time communicating with Bustamante in trying to move forward in a more uniform and documented way of helping Jamaica. Basically, Columbia University was advising them on a lot of their pediatric oncology cases, but they were doing it in a non-standard way. So this year they decided they wanted to do it in a standard way. Actually, it's been going on for maybe 2 years now. And they were having a hard time moving forward with the paperwork. It was stuck at the Ministry of Health. So being that I have a good relationship with the Jamaica government, I kind of serve as like a broker. Like a collaborative effort, having Bustamante Hospital and Columbia University talk and try to get this project done. And so ultimately the disenfranchised, the poor people of Jamaica who are dying from leukemia and other childhood cancers, could formulate some kind of a therapy and treat these patients in a timely manner so they don't have to die. Firstly, I want to say that I had the privilege of meeting Dr. Hugh Wong. And he was part of the leadership of Kingston Public Hospital Accidents and Emergency Department. And meeting with Dr. Wong allowed me to understand what the physician on the ground, on the front line, those physicians on the front line, what they have to deal with. The resources are sometimes not available for them. However, they find innovative ways of getting the job done, basically. And I learned an appreciation. Through the conferences for the past 6 years, I realized that these doctors are very much the top doctors. They would compete with any doctors anywhere in the world. However, they didn't have the resources, they didn't have the equipment sometimes to get their job done. And that's why I was very much motivated and passionate about getting them ultrasound machines down there in Jamaica. If you'd like to donate to the Jaja Foundation, it's very simple. You can go on our webpage at jajafoundation.org. That's JAHFoundation.org. Once you go on the web page, you'll see that there's a button for donate. You can just click that button, and MasterCard, Visa, whatever you have, you can donate money directly to the organization. And trust me, every one of your dollar you send goes directly to the people of Jamaica. There's no administrative fee and cost that's going to make your money dissipate before it reaches the people itself. So support the Jaja Foundation. That's JAHFoundation.org. I mean, if you come to our function, you see, if you interview the folks that are here, many of them are physicians, many of them are healthcare professionals, nurses, x-ray technicians, CAT scan technicians, radiation therapists. We have people who work in the advertising industry. We have people who work in marketing. We have people who work in lawyers. So we have a wide range of people who support the Jaja Foundation. And it's not just Jamaicans. We have people from Trinidad, Puerto Rico. We just get people who are kind-minded, and they believe in something, and they believe in me, and they believe in the Jaja Foundation. I want to say what's up to all the people in Jamaica, people in Kingston, Jamaica. Big up Uptown Mondays, Whitty. I want to big up all the people in Mandeville, all the people in Christiana, Kingston Public Hospital, Bustamante Hospital, Cornwall Regional, Mandeville Hospital, Maypen Hospital, all those hospitals that I've had a privilege to visit. I want to big up all those people on the front line trying to provide health care in a very challenging time.
Okay, my name is Roy, and I'm the Vice President for Trans-Caribbean Express Shippers in New Jersey, that's located in New Jersey. And I'm involved with Jaja Foundation in the export of their products to Jamaica. We made a couple of pickups from Beth Israel Hospital in Newark, New Jersey. And we shipped them out, we packaged them, shipped them out. We also did a 20-foot container load for them. The last shipment we did was some cabinets and some sinks that they had to ship out. But we are always involved in helping them with the shipment. Our shipping company has been around for 25 years, and we are very active in helping the communities in Jamaica. Our contact number is 973-676-8625. And we have a website, www.transcaribe.com. That is TRANSCARIBE.com. And we are located in East Orange, New Jersey. We're willing to help. Almost anyone that has a need for shipping, for any kind of shipments. If you're shipping for yourself or if you have a foundation, or if you're shipping things home for your communities, you can get in touch with us, because we're willing to help you in the best way we can.
My name is Maureen Foster Huey. I'm a physician assistant at Harlem Hospital. I'm the secretary for the Friends of Ulster Spring Hospital International Incorporation. And our organization is a part of the Jaja Foundation. We're working together to try to get the Ulster Spring Hospital, which was closed from 1980s, and people are dying in the area. So we're working together as a group to try to get this hospital reopened.
My name is Monica Dixon, and I'm here to support the cause for helping Jamaicans abroad.
I go back to Jamaica a lot. I mean, when I say I go back to Jamaica a lot, I go back to Jamaica a lot. And for everyone here who has been back to Jamaica, I know the feeling you get in your stomach. And it doesn't have to be Jamaica. Those of you from Puerto Rico, Guyana, or wherever you're from, you know when you go back home and you see the condition, you say, man, this could have been me. Because you could have went to the embassy, the U.S. embassy there, and they could have denied your visa, you know? And you could have been one of those people who have to go into this hospital in this decrepit situation that it's in. And you could have been that one in that situation. So let's not forget where we're from. Let's not forget where we're coming from, okay? Because everyone who's in here who was not born in this country had to apply for a visa to get here, and it could have been denied. And I look at some of my friends and loved ones back home who I know they wish they were in my shoes. So you know what? I just give them what I can give. Dr. Wong said to me, Trevor, we need to teach these doctors how to use the ultrasound machine. Basically, it's a longer story than that, but that is basically what it was. Dr. Wong said, teach me how to use the ultrasound machine, and I have these 8 machines that were given to us by the government, and the doctors don't know how to use the machines. So 8 portable ultrasound machines we don't know how to use. Can you teach our doctors how to use it? And I said, yes, I will help you, the doctors, use the ultrasound machine. So it wasn't about me. He had a need, and I said, I'm going to go back to my folks in America and ask them to help me fulfill that need. Okay? So then I started to do the ultrasound training course in Jamaica. And basically, for those of you who don't understand what the ultrasound does, it allows when trauma patients come into the emergency room, it allows you to take a quick look into their belly to see if they have bleeding blood in their belly. Okay? The CAT scan machine sometimes is not even working at KPH. They don't forget about MRI. Okay? So the CAT scan machine oftentimes is down, and you know how long it takes. They have a lot of people in radiology here. You know how long it can take to get a machine fixed, even when you have the resources here in America. Okay? So if somebody comes with a gunshot wound or penetrating trauma stab, or whether it's a car accident, and you want to determine if there's fluid in their belly, the ultrasound is very helpful.
I'm Dr. Morgan, as Dr. Dixon introduced me. I worked at a Kingston Public Hospital between 2004 and 2006. But one of my rotation was through the Bussamante Children's Hospital. During my time there, I realized that many other kids who were treated for cancer were treated, 1, in general population, and 2, sometimes they were not protocols. So on my return here, I started doing research at Columbia, and I traveled back to Jamaica, met with Dr. Sonia Henry, who was at the time the SMO for the hospital, and she reached out to me to tell me that she needed some help with care, protocol, and treatment for kids with cancer in Jamaica. So knowing some of the faculty at Columbia University, I ended up reaching out to them, and without any hesitation, they were on board. And since I think 2009 until now, they've started a weekly conference where cases are presented to the Columbia Pediatric faculty and guidelines are being provided.
It's presented to Erwin Clare Sr. in appreciation and recognition for your unwavering support of the Jaja Foundation and selfless commitment and contribution to the Caribbean American community throughout the United States of America. Thank you, sir, on behalf of the Jaja Foundation and all these people here.
I just want to say that I am grateful for this award. I'm also proud of the fact that my daughter is here with me in the audience, so that even makes it even more thrilling for me. And I'd like her to come up and join me just now. She has a presentation to make to Dr. T on behalf of Team Jamaica Baker. But before she does that, I just want to take this opportunity to say this, that when Dr. T came to us about Jaja, I too said, is that not a Rastaman business? But after he indicated what he was working on, it was obvious that this was a winner. And he mentioned that when he takes on things, he's gonna do it. That's not true. He not only does it, he does it to the max. It's imperative that these type of initiatives are supported. It is imperative that when individuals put themselves out to volunteer, that others recognize what is really going on. You may not be able to do or give the 100% that he does, but your 10% and the 10% from your friend makes 100%.
Yonkers.